Great. Well, thank you all so much for tuning in today's webinar, Charting the Course, a panel discussion on navigating dietitian licensure advocacy across states. I am pleased to help host and moderate our discussion today. If you're just tuning in, my name is Kat Rudolph. I am the state policy representative for the Iowa Academy of Nutrition and Dietetics. So our webinar this afternoon is going to begin with a brief presentation from the policy initiatives and advocacy staff, Charlotte and Lisa from the Academy of Nutrition and Dietetics. And then that will be followed by a panel discussion with speakers representing North Carolina, Missouri, Iowa, and Idaho. Our objectives for our webinar today are to increase understanding of the importance of licensure in our dietetics profession, and then get to know a little bit more about the state of licensure across various Academy state affiliates. We also hope that you will learn different skills and strategies around licensure advocacy and how to feel comfortable speaking with legislators on the topic. We also hope to have the opportunity just to brainstorm with dietetics professionals across different states on some of the best practices for advocating for licensure. So at this time, Charlotte and Lisa, I will pass it off to you.
Thank you. So I'm Charlotte Burrow, and I am our Senior Director of State Government and Legislative Affairs with the Academy. And then I have with me Lisa Eaton-Wright. I'll let her briefly introduce herself.
Hello, everyone. Lisa Eaton-Wright, Director of Consumer Protection and Licensure. Glad to be here.
And real quick, we're going to just run through some of the things that we're facing regarding licensure across the country, talk a little bit about our Model Practice Act, and then an update on the Dietitian Licensure Compact, noting that we're only going to take about 10 minutes of your time. So I'm just going to throw a lot of information out there. And then Lisa's going to run through some of those resources where you can follow up with us to get more information, or if you want to go more in depth on your state, how you can reach out to us. So with that, next slide. There we just have our slides for who we are. So in terms of what we're seeing across the country, particularly over the last legislative session, are a few what we were calling red tape reduction, which I'll talk about on the next slide, actual potential repeal of practice acts across the country, and then universal licensure recognition laws. So these are some of the hurdles that we're facing, or issues that we're facing, not just to our profession, but really in terms of regulation across the country. Next slide. So red tape reduction, what they're deeming it that sort of language. You've seen a couple other titles, but at the end of the day, the goal is to eliminate the licensing boards themselves under this type of law. So not necessarily the Practice Act, but they're looking at the fact that we have licensing boards across the country and questioning whether or not they are really necessary to fulfill the mission of the Practice Act, or if a licensing agency can meet that need. And for our profession, because our laws vary across the country in terms of, we have some licensing laws that provide for the licensing of a title and don't license the practice, and we have others that license the practice. The need for a board, that there's more questions sometimes raised when the board isn't able to receive complaints about practice of the profession necessarily, or they don't have authority over practice of the profession. So particularly in those states, it's a little bit of a harder battle to climb, or battle to fight, as far as justifying the need for the board when they are just issuing the license but not receiving complaints about practice of the profession. Now, I think, and the alternative on the other side of that is, the need for actually regulating the profession so that the board has authority over that. But that is something that we're facing. And so this is just highlighting for you that is something that we've seen a trend across the country, is a proposal of eliminating the licensing boards themselves. Next slide. We also have a proposed legislation that would eliminate the actual licensing of the profession. And so that is, while the first form of legislation is concerning, this is even more concerning in that it would totally eliminate the licensing law itself. So in terms of when you think about that, what does that do, or how are you defending the fact that you have a licensing law and the need for it? Well, originally when our laws started to be passed over 30 years ago, the RD credential was really the only significant nutrition credential out there. But now, as you are well aware, we have many types of nutrition credentials out there. We have many types of nutrition practitioners. So I would say there's even more need for regulation and identifying who is a qualified practitioner than there ever was in the past. Additionally, we have reimbursement. So oftentimes insurance companies look to licensing to identify who is a qualified provider. So when you don't have licensure, that it's a question of access to care. Are we decreasing access to care because we no longer have the ability to identify who is a qualified practitioner under the law? Scope of practice is also something significant in terms of licensure. Licensure is what generally gives you your scope of practice, legal scope of practice in a profession. And so it's particularly for our practice of medical nutrition therapy. When you look at most of the licensing laws across the country or the professions, states license the practice of medicine. And if you were to look at that definition in your state, you would see that within that, really medical nutrition therapy falls under the practice of medicine. So if you don't have licensure in your state, I would question where is your authority to even be able to practice medical nutrition therapy legally or lawfully it under the law. I think it's just, that is what gives you the authority is your licensing law. And then for the dietitian licensure compact, a state's ability to be able to participate in the dietitian licensure compact is contingent on the state providing for licensing or regulation of the profession through either licensing or certification. So if you don't have a law in your state, then that state will not be able to participate, which again impacts access to care in the sense that, this is expanding access to care. And if you don't have a licensing law, it would not be able to participate in that. And then at the end of the day, something that, and when I was in North Carolina, we faced when we had our proposals to eliminate our law was even if we don't have a lot of demonstration of, complaints or real significant harm that has happened since our law has passed, that doesn't necessarily indicate that the law is not effective at all. It might indicate the exact opposite, that the law is doing what it was supposed to do and was designed to do, is that it is keeping people from practicing at a lower level or, that's not in the best interest of the public. So I think, just because you may not have many complaints or the, stories of harm since the law is passed, that does not necessarily mean that the law is not necessary. Next slide. So the other thing that we are seeing out there is what is called the universal licensure recognition laws. So we're seeing bills that potentially would eliminate the licensing board. We're seeing bills that potentially might eliminate our licensing laws. And then we're seeing bills, universal licensure recognition bills, that change our licensing requirements. So you may have a path to licensure in your state that really leads to a qualified dietitian. It aligns with the RD credential and it meets those requirements for licensure. But what a universal licensure law says is generally, so there are various different versions of it. But generally speaking, many of them that we're seeing say, if you're licensed in any state, you can get licensed in our state. And where that's not necessarily a problem for other professions because they have consistent requirements for licensure across the country. In our profession, where our requirements for licensure vary so much, that is a problem because you take the state with the lowest standards potentially, get licensed in that state. And then if a state has high standards for licensure, but then on top of it, they pass a universal licensure recognition law that's really broad, then it doesn't matter what the standards for licensure were in your state. You could come in simply because you were licensed in another state. So for our profession, those really represent a concern because they're diluting who the public has come to know as a dietitian and the fact that, historically a dietitian has aligned with the RD credential. But now these seek to potentially water that down. So those are the three things that we are, generally facing in terms of, hurdles to licensure or issues that we are facing in the upcoming legislative session and have been facing for the past few years at least. Next slide. So what is, solution? What are we working on? So definitely if you're facing a bill that would propose to eliminate your law, there's the things that I discussed that we want to help you support in terms of your advocacy. But a proactive approach to licensure is our Model Practice Act. In our Model Practice Act, we're trying to address many of the concerns that our legislators have had we've heard arguments that our laws are too broad, that they potentially are regulating speech and not just the profession. And so our Model Practice Act focuses on the licensing of medical nutrition therapy, where we know there's a significant risk of harm if someone's not qualified to provide that service. It's also aligning us with the practice of medicine in that regard, in terms of what we're licensing. We've ensured in our Model Practice Act that we have pathways that would lead to qualified nutrition practitioners, those being a licensed dietitian on par with the RD credential, and a secondary pathway that would recognize other types of nutrition practitioners that are not dietitians, with a different scope of practice. We provided in our Model Practice Act a clear scope of practice, one that aligns with the RD credential in terms for the dietitian. And then, like I said, we have a secondary path for licensed nutritionists. It's important in our licensing laws that our licensing laws are keeping pace with the profession. So if your licensing law is not allowing you to practice at your level of competence, then it's really not acting in the best interest of the public, because it's delaying the public's access to timely and qualified care. And so our Model Practice Act ensures that dietitians are able to practice in line with their scope of practice as that scope of practice continues to evolve and expand. And then we have clear exemptions in our Model Practice Act that help to address many of the concerns that we've heard from legislators, again, about our laws being overly broad or not narrowly focused on where there's the most significant risk of harm. Next. So ultimately, the goals of our Model Practice Act are to ensure that our laws are really narrowly focused on where there's this most significant risk of harm. So should we sustain additional legal challenges down the road, we can withstand those legal challenges and know that our laws are acting in the best interest of the public. We want to ensure that we have consistent licensure qualifications for all nutrition professionals. And so, again, historically, our practice acts have kind of varied as far as what the requirements are. And so the aim is to ensure that we get more consistent requirements in our licensing laws so they don't vary from state to state. We're aiming to address the universal licensure recognition laws. They're not going away, although they're not all as significant as the way I described. They've been passed in about 20 states at this point. And so we know that that's a significant tool that our legislators are using. And we need to, this is a solution that we feel, keeps or maintains who a dietitian is for the public. And then at the end of the day, we want to be able to ensure that our dietitians are able to practice at their level of competence for the reasons I've already stated. And we believe our Model Practice Act does that. So you're facing things out there. We know that there are these trends, and, so we want to help support you in terms of defending your laws, but in a proactive manner. We want to work with you to work on enacting legislation that is consistent with our Model Practice Act. So that's real brief. I know it's a lot of information again, but sharing that with you, and then encourage you to reach out to us. And Lisa's going to give you more information on how you can reach out to us in our various resources. So Lisa, I'll turn it over to you.
Thanks, Charla. So yeah, we're going to talk about the Dietitian Licensure Compact, and hopefully you've all heard a little bit about that at this point. And I will note that I saw a question in the chat box that related to, this is a dietitian licensure compact. And as we work through the states and work through the advocacy strategy and the separate affiliates, we'll dive deeper into those questions, but this is set up to be for dietitians. And then there's another up pathway in there as well, following the requirements to be a licensed dietitian. So could you go to the next slide real quick, please? So this is a website where you can get information. The link is down at the bottom. So you can go there. There's plenty of information. Recordings are there from the public comment webinars. But I will tell you that as we're working through this, the draft is like a hair from being finalized. And there's going to be a whole new website created specifically for this that the Council on State Governments is working for. Hopefully this week, later this week, if not next week. So we will be sending out a new link so that everybody can access the link to that new webpage. Next slide, please. So quickly, for all of those that if you are or are not familiar with the benefits of participating in that compact, It is about improving access to MNT, and Charlotte talked about like improving access to care, opportunities for telehealth, which has exploded post-pandemic, enhanced mobility, again, telehealth and being able to practice across state lines, access to and that continuity of care, and then of course enhancing licensure verification. So I'm going to note, as we did allude to briefly at the beginning, we are moving into the next stage of the compact, and it's the legislative advocacy stage. And we do have an affiliate advocacy strategy. So I want you to know we've been thoughtful about this and we've been strategic. And consequently, we are going to be sending out meeting invites to presidents to start scheduling meetings over the next few months to begin the advocacy strategy across the states. There are way more of you than there are of us, so please be patient. I know everybody's anxious, but we are going to lead you through this next process. And of course, Charlotte briefly said, Iowa, in particular, in other states, you need to have a licensure law in place in order to participate in a licensure compact. Next slide. So quickly, just two key resources for you. The Licensure Affinity Group meets on a monthly basis. This group is an extension of me and Charla. Everything that we know, share, that you should know, that you, if you want to ask a question, is going to happen in that group. So we're trying to encourage as many people to participate in that affinity group on a monthly basis so that you can stay. And if you can't go, send somebody from your affiliate who can go in your set and serve as a proxy and then take that information back or pose all the questions that they want in that group. And then finally, there's licensure office hours. Those are weekly. And we meet with individual practitioners who come to the table. They might be, setting up part of a group practice. They might be setting up their own private practice. They just want to understand licensure laws. They come into that group 2 to 3. We are there top to bottom, whether somebody's there or not. So please join us every Wednesday from 2 to 3 Eastern. And with that, I'm going to turn it over to you, Kat.
Thank you both so much. That was so much information. There's so much to learn on this topic, and Lisa and Charlotte are wonderful resources. I will say we had a couple of advanced questions about the compact that came in that I don't know if we'll have time to address today, but I would encourage everybody to ask their questions in one of these couple of resources. Lisa, Charlotte, are we able to provide your email as well for people to reach out, or would you prefer them to try to connect in one of these resources?
They can do all of the above. You can provide our emails, and they can absolutely come to the affinity group or office hours. We're happy to answer questions at either any of those places.
Awesome. Thank you all so much. Okay, so now I'm excited to introduce all of you to our speakers for our panel discussion today. Manju, Connie, Kylie, and Tina. I'm going to have each of you go around and introduce yourself, maybe your name, where you're from, your position within your state affiliate, and then what area of dietetics you work in.
Sure. Thank you so much, Kat. And thank you, Charla and Lisa, for kind of getting us started with the broad overview of all the dietetic licensure things. I'm Manju Karkare, as Kat mentioned. I am in North Carolina. I am the current vice chair of the Legislative and Public Policy Committee for the Academy. Although in my own affiliate, I have served as the reimbursement representative back when they were called that, as well as public policy coordinator, and have worked through when our licensure got modified a few years ago. I'll pass it on to Connie.
Thanks, Manju, and thanks, Kat, for getting this together. Really appreciate it. Connie Dickman. I am in St. Louis, and in Missouri, I am the state regulatory specialist, have been for several years, and continue in that position. I'm trying to remember what other questions you had, Kat. Oh, and I'm past chair of ANPAC. I knew there was one other thing. Thank you. And Tina?
Yeah, I'm Tina Bauermeister, and I'm in Iowa. I'm actually in Spirit Lake, Iowa, Northwest Iowa. I'm the Consumer Protection Coordinator for the state. And I work at a small rural hospital where I'm the diabetes educator, the kitchen manager, the dietitian, all of the above. I wear many hats. Kylie?
Hi, and thank you. And hello, everybody. My name is Kylie Goff, and I am located in South Central Idaho. Twin Falls to be exact, and I am a part of a larger health system in the state of Idaho, and I serve as our community health manager there. So in a certain part of our region, called the Magic Valley, I sort of oversee that work. And I am our past president of the Idaho Academy of Nutrition and Dietetics, and former position as a treasurer with our board as well. So glad to be here today.
Hey, well, thank you all so much for being with us and being willing to share your experiences and perspectives. We're going to start jumping into our questions. And just so attendees know, we want to make this kind of a casual conversation. So feel free to write in questions. If we're not able to incorporate them in, then we'll definitely try to address them at the end and have some other time to address your questions. So today, as you know, we're here to talk about advocacy and around licensure within our dietetics profession. So first, we want to start off, and I know Charlotte and Lisa, you kind of talked about this as well, but just want to hear from a couple of our panelists why this topic is so important. We also had an advanced question from one of our registered attendees that wanted some clarification on why licensure is important when dietitians can be registered nationwide. So I'd like to ask our panel, why is licensure so important to our profession from your perspective? And I'll start off with Tina.
Sure. So, and Charlotte, go ahead and correct me if I get this wrong. But to me, licensure is an additional layer of consumer protection beyond registration. So CDR, which is the Commission on Dietetic Registration, who maintains credentials for dietitians, doesn't have the authority to listen to complaints if a dietitian practices out of the scope of their practice. Again, correct me if I'm wrong. CDR and state licensure boards are separate. There is something called title protection, which Charlotte talked about. It restricts usage of specified titles, but it is a less protective approach. So licensure is a step above that by regulating the practice of licensed RDNs. And licensure protects the public. The public can rest assured that all qualifications are met. And licensing laws help consumers identify who is a qualified practitioner to provide services within the scope of practice, just like Charlotte was talking about how we probably need even more regulation at this point. So.
Yeah, I'll just note that, CDR does have authority when someone files a complaint regarding a registered dietitian, as far as like under the code of ethics, and to pursue that. But that is particular, only to registered dietitians and their authority over that person. Licensing is much more robust authority and gives the state the authority over a person in their practice. Generally speaking, states don't want to exceed all their authority to a private credentialing body. They want the authority over the practitioners because then they, like I said, they can take away their license, they can discipline, they can do all the things that they have control over in terms of licensing. The other part that she mentioned at the end, I think is significant now that, we do rely on our RD credential, and it is a trusted credential, but there are many other types of nutrition credentials out there. There's many other types of nutrition practitioners. So licensure is not just about the RD. It's about protecting the public and who is a qualified practitioner. The RD represents a qualified practitioner to the public, but without licensure, you're not regulating the whole practice of the profession. Licensure is what provides the state authority to regulate truly the practice of medical nutrition therapy and dietetics.
Great. Thank you, Charlotte. And for sake of time, I'm going to have us hop into that next question. I feel like that was a lot of great information about the importance of licensure. So we all know that licensure looks different in every state. So for all of the speakers, what is the current state of licensure in your state? You might share some recent stories or events that have taken place, and maybe what the political landscape is like around licensure in your state. So Connie, I'm going to have you start us off.
Sure. Thanks, Kat. So in Missouri, we are licensed, and statutes do protect and define dietetics practice, our title, who is the licensed dietitian, MNT, and the RD. We also have statutes on what can happen if someone else performs any of the duties as described under the dietitian, and clearly aligns with what the Model Practice Act looks at from the standpoint of, skill sets that allow you to do something within what we might view as our purview, but don't call yourself a dietitian. Currently in Missouri, we are working on a gap that we missed the last time we updated our licensure, and that is for provisional or temporary licensure. Currently, new grads who take time to study for the exam are having difficulty getting employment because they can't be employed as a dietitian or do any of the jobs defined in our licensure. So we are working on that. We did submit it this last year. It never came out of committee. And we learned that it was because there was a lot of confusion around why it was needed. Other medical professions, which I did not know, PT specifically, because one of the reps is a PT and she happens to actually be my rep, they kept asking, well, why can't they take the exam before they finish their program? That's what PTs do. We tried, but it just, nothing happened. So, what we learned from it is things that we assume are not necessarily understood by the legislators. And since then, we've had a really good conversation with her in terms of, all right, here's who we are, here's what we need to do, how are we going to do this? And the good news is she is going to introduce our provisional licensure bill for the coming year. So good came out of darn.
Great. Thank you, Connie. Kylie?
Yeah, thank you. And in Idaho, currently our dietitians are licensed in our state, and our licensure falls under the Board of Medicine. We have the Idaho Division of Occupational and Professional Licenses. This was actually recently created under a bill from the direction of our governor to oversee protection of consumer and public safety. And so the Board of Medicine is actually positioned under what we call IDOPL, and hence so are dietitians at this point. In Idaho, as some of you may know, it is, a Republican state, pretty conservative state. So a large focus from our governor has been on consolidation and increased efficiencies aimed to save Idaho time and money. So that's something that has impacted us well in the dietitian world. So in 2022, IDOPL brought forward a new bill that pushed to have a new allied health board consisting of physical therapists, occupational therapists, athletic trainers, respiratory therapists, and registered dietitians. And we were sort of, I would say, blindsided by that bill. It was really far along at the point that we became aware that it was happening. And we're fortunate to be able to reach out to our longtime lobbyists and supporter of our dietitians who had kind of been through some things with us in the past to help us champion our position to the bill and kind of get us connected where we needed to defend our position. At the time, the bill, we felt, like I said, blindsided. So we were able to get some questions and answers with them and really found out, some of the other professions weren't really interested in this restructure as well. And fortunately, we were able at that time to defend our position, and we did not move forward at that time. But here we are again. So currently IDOPL has drafted a new bill looking to consolidate registered dietitians with different groups. So naturopaths, respiratory therapists, and athletic trainers. And this really comes from the feedback they received from us. Two things. One, they've let us know earlier that this is happening, so we're aware and having conversations with them now. And that all of these disciplines are under Board of Medicine, and all the groups in the response initially said, we don't want to be pulled from Board of Medicine. We feel like there's power and reason to be positioned there. And so these four disciplines would remain under the Board of Medicine, which again would be under IDOPL. We've had one meeting to date with them and the other professions to kind of learn the just general pieces of the bill, but we have not been shared the drafted language at this time. They do anticipate they will share it with us as it becomes available, but they have just initially shared that draft with the governor. At the same time, I think Idaho's learning more about compact licensure. And as it sits today, we know that we would not be able to be a part of compact for two reasons. One would be the background checks that are required in fingerprinting, and then two, the Practice Act requirements. So in our licensure, we do not have language around Practice Act at this time. And so that's something we're kind of learning more about and investigating. So our biggest concerns right now surrounding licensure is ensuring our dietetic practice protections here, preserve licensure that we have today and the benefits to our profession now into the future. So it's kind of risky to open our licensure bill, potentially leading to revisions that jeopardize the current protections of the dietetic profession in Idaho. So we're really being cautious and considerate of those things as we proceed with this group. So that's where we stand today. Thank you.
If I can just interject real quick regarding the compact and hearing some comments, just to make sure information shared is correct. So regarding the compact, you can actually participate. So it doesn't have to license practice of the profession. You're licensing dietetics, as far as in that definition of dietetics is broad. So either you're licensing the title or licensing the practice or both. So in that, from that reason, you could participate as a state. The only states that would not be able to participate in the dietitian licensure compact are those states that do not provide for regulation of the practice through having a board or a state agency that regulates the practice. So that'd be California, Virginia, Michigan, Arizona, and Colorado. Other than that, we anticipate that all the states will be able to participate in the compact. And then the other piece you had mentioned about background checks. There's quite a few states that don't provide for the background check piece. That's not uncommon. We've seen that inconsistent in all the other compacts. And so it's something that and because there are some states that do provide for that requirement. And so CSG, the Council of State Governments that's helping us draft this, has indicated it is a best practice. So that language is provided for, but generally how that moves forward is that you put forward separate legislation that gives the board authority or the state agency authority to do the background check piece when you put the compact legislation forward. So we understand it's not a part of everyone's law presently, or many states' laws presently, to do background checks, but you would provide for that in the legislation that we put forward when you put forward compact legislation to give the board or state agency that authority at that time.
Thank you, Charlotte. That's incredibly helpful. I think that we had a bit of misunderstanding on those points, so I appreciate your clarification.
Gotcha.
Thank you, Charlotte. I'm also wondering, I don't know if this is something that Charlotte, you know, or anybody else on the panel, but we got an interesting question from Patty in the chat. Does anybody know what the current state of licensure of professionals other than RDs who have been granted nutritionist licensure in states that have enacted 2 pathways for licensure? Are those holding the CNS certificate being licensed?
I can definitely add to that in North Carolina. I'll kind of combine a little bit of, what your question is on the slide and also talk about the CNS. So North Carolina, fortunately, has had licensure since 1991. And the very first board was actually appointed back in 1992. But our licensing board also came under threat of elimination, just like we heard earlier, when our legislature decided to do a study of all occupational licensing boards and, figure out, is it necessary? Do we really need to spend money? But it was very well proven that our licensing board operated with the licensing fees that licensees pay, and there is no state budget impact on it. And so we kind of cleared with flying colors, shall I say, and our licensing board was saved out of that study. And we were also then in the midst of modernizing our licensure bill. And I'm going to lean on Charlotte again. Charlotte, please feel free to jump in, because Charlotte was actually part of this process as well. It took several years, as many of you, who have gone through this. It doesn't always happen in one legislative session. You have to keep going again and again and again, several years to have these conversations. But in 2018, we were actually able to amend the Licensure Act really to reflect the substantial changes that have taken place in our practice. It included diet order writing. It included a new pathway to licensure, which is where the CNSs come in, right? We did some compromising in the state, and we have included the certified nutrition specialist, credentialed practitioners. There is a specific pathway created for them also to get licensed under the same licensing board. There have been, it's not very straightforward because they actually have to have supervised practice. And I can't tell you all the details, but there is a pathway. So we actually worked with that organization, instead of, fighting against, we included and came together in putting forth a compromise and having pathways for licensure that are for RDs as well as CNSs. And I will lean on Charlotte to, give any more details if she had. But our board currently does have, 5 nutrition professionals, 1 licensed physician, and 1 non-medical public member on the board. And the statute specifically does define MNT as the provision of nutrition care services, really for the purpose of managing and treating a medical condition. And we included in that MNT via telehealth is not prohibited. So it doesn't necessarily say that, yes, you can do it, but it says it's not prohibited. And then, a license actually is required to provide telehealth to North Carolina residents by practitioners who don't live in North Carolina. Charlotte, do you have anything else to add about the CNS pathway we worked on?
Yeah, the only thing or clarification I provide is because there's no other nutrition credential out there besides the RD that provides for programmatic accreditation for the academic and the supervised practice piece. So by programmatic accreditation, I'm referring to like our Ascend type body. So that is required for the RD credential, that you complete an Ascend accredited academic program, that you complete an Ascend accredited supervised practice. Like I said, there's no other nutrition credential that provides for that, including the CNS credential. They don't require that. The CNS credential requires a master's in nutrition or a doctorate level of healthcare with minimum requirements of nutrition courses, 1,000 hours of supervised practice, and passage of an exam. And that credential has what's called NCCA accreditation, which is the same thing that accredits like the RD credential itself. So for those reasons, the examination for the CNS credential is recognized in North Carolina's law. So if you hold the CNS credential, you can show that to the board to demonstrate you've passed an exam recognized by the board. But the board does not recognize the credential in terms of looking at your supervised practice or your academic requirements and saying that you've met the requirements. You have to actually demonstrate to the board that you have met the requirements of the statute by showing your transcripts, your courses, providing a tracking log and that to document your supervised practice. Because again, that credential doesn't have the programmatic accreditation piece. So in North Carolina, for the dietitian pathway, you can get licensed by endorsement of your RD credential, meaning you show us your RD and you can get licensed because we know what's built into that. But for the licensed nutritionist pathway, the applicant actually has to prove to the board that they have met all the qualifying requirements. And then they can show that they hold the CNS credential to show that they've passed an exam recognized by the board. But that's the only thing it's recognized for. So we actually call it a pathway for qualified nutrition professionals rather than saying we're licensing CNSs.
Thank you so much, Charlotte. There is so much to learn about this topic. Just so everybody knows, I have been getting some questions. This is being recorded and we will share the recording. So if you want to go back through and listen to some of these things and process and see if you have some more questions, we will have a recording. Manju, I wonder if you could just go into talking about the current state of licensure in your state.
So we are licensed, right, as we were just talking about, and we do have this pathway for the CNSs, how they can, as Charlotte just described, how you have to actually show everything so they can get the licensed nutritionist pathway as well. Fortunately, our licensing board and licensure is okay right now, but yes, there are always times when we watch out for, as we heard from other members on the panel here. There are other practitioners in areas. They are also putting forth bills and what it might include. So you always want to be on the lookout. And we also work with lobbyists here. They are our eyes and ears at the legislature. So if they see something that's happening, then we are notified. And also now, as you know, the Academy also has state legislature tracking online. So you can actually see what are certain bills that are being tracked in your state, so that what might be there. And that's actually how I found out about this law about the medical arts. I'm probably butchering the name of that, but there are, yes, naturopaths and reflexologists and some that have put forth a law for licensing. And I don't know what it might include, because a lot of times naturopaths do nutrition therapy, and I don't know what it's going to be. So we'll be watching. For now, we're okay, but you always have to keep your eyes and ears open.
Absolutely. Tina, do you want to share about what's happening in Iowa?
Sure. In Iowa, the Board of Dietetics and possibly licensure down the road is being threatened. Last month, our governor, Kim Reynolds, she asked a state committee called the Boards and Commissions Review Committee to review 256 boards and commissions. And the final report was approved recently. And the governor is going to propose legislation next year when we start in session in January to eliminate the Board of Dietetics, because that was the recommendation from that committee. Unfortunately, even though our Board of Dietetics met virtually and only met as needed, the committee decided to eliminate our board, despite other professions like the Athletic Trainers Association. It's really disheartening, of course. They eliminated 111 boards and commissions, leaving 145 in place. So, we've heard from other states that, yes, of course, they do have to look at these boards and commissions and make sure that we're doing what we're supposed to be doing. But of course, like Charlotte was saying earlier, the law is there and it's doing what it's designed to do. So it's very frustrating. One thing I'd just like to point out is that legislators are not dietitians. And most of them have limited knowledge of what dietitians do. And they don't understand that CDR is separate from licensure, and that title protection is a less proactive approach. So my other comment is we need a license to fish. I mean, come on, in Iowa, we could have a license to be a professional, right? That's my 2 cents.
Yeah, absolutely. Thanks, Tina. I mean, we have heard that, some of the big groups that are trying to fight dietetics licensure are putting our profession off as like, why would you need a license to tell somebody what to buy from the grocery store? So I know a big piece in Iowa is that a lot of our legislators do not know what dietitians do, and that it's actually much more complicated than that. So that's certainly our big piece that we're always trying to get across. Thank you all so much for talking about the state of licensure in your states. Okay, so for those of us who know that licensure issues are important and maybe know the status of licensure issues within our state, but don't know how to best go about speaking on the topic with legislators, I'm wondering if our panel can talk about what some effective talking points are that you've used with legislators when discussing licensure advocacy. And Kylie, I'm wondering if you'll get us started.
Yeah, sure. It's so disheartening to hear your comments, Tina. That's so unfortunate. And licensure is so important. So I think we're all here for that reason. And, representing Idaho, I think we remain committed to the importance of licensure in our state. With the recent bills to consolidate boards, our primary focus has been on protecting our licensure status under the Board of Medicine. And I think our lobbyist said this to me at one time, and it really has stood with me. And I think it's kind of remained our stance, is that we like where we are. So tell us how a change is better. And that, I think, has led us to a curious attitude rather than a critical one, to ask good questions. And I think that has benefited us ultimately in our discussions with IDOPL. Idaho does have a lobbyist that we have a well-established relationship with for actually many years. We've kind of engaged, and then had times when we didn't need to, but at this point are engaging with that person, and they have been a wonderful resource and support to us in understanding relationships, timing, key questions to be thinking of, and are likely a resource, I would say, for other states to be considering. Idaho dietitians reacted swiftly when we learned about the proposed changes in the previous bill that I mentioned earlier, House Bill 28. One of the strongest arguments the last session was that we were not consulted nor notified of the proposed changes impacting our profession. and that we are willing to come to the table to discuss options. So, we are a player, we're willing to be curious and learn and see what makes sense. But this point, I think, was well received by Health and Welfare Committee last bill. So that really resulted in the tabled vote. So that did not go through, but we just remain committed right here and now to what's in front of us, and making sure that we're really representing our dietitians across the state well, asking good questions. And again, just I'd say reiterating that we like where we're at. So again, tell us why a change would be better. Thanks, Kat.
Thank you, Kylie. I think that's a really good point. We would definitely much rather be at the table than excluded entirely in these discussions when they're proposing changes. Let's see, Manju, would you start off next?
Yeah, so I was actually going to just say, Kylie, what a great, thing that you also have lobbyists and that you were kind of alerted to. That is very important because, we are in doing our jobs as dietitians, right? We're not there. So that's the importance of actually working with the lobbyists in the states. That's definitely important. And also how you shared that, if you're willing to have a conversation, let's talk about it. And that conversation does come around really well if we have, built relationships with the legislators. And I know earlier also you heard that legislators are not dietitians. A lot of times, many of them are not even in healthcare. And so it's important for us to have a relationship. And sometimes I say that whether your licensure is at risk or not, or if there is something happening, all of us as citizens need to know who represents us in the state house, in the state senate, in the US House, in the US Senate, right? We are constituents. They are there representing us, whether it's in the state or in the US. And it is so important for us to maintain that relationship and be, kind of just have that contact that, hey, I'm in your district. This is what I do, just so that they know who a dietitian is, what a dietitian does. And really, which then, as Kylie mentioned, you can actually say, hey, let's talk about this. This impacts my life as your constituent. This impacts how I do business, how I work in the state. And employment, jobs, these are the things that come across, sometimes I have found even more than public safety. I know we all want the public to be protected, making sure that they're getting the nutrition advice from qualified professionals. But sometimes it also does come across that, look, this impacts how I work. And I'm your constituent, and I want to talk to you about this and how that is really important. And having that relationship can also then, get you at the table quickly. So fortunately, right now, we just want to maintain the validity of our license. We can always talk about how we have been one of the states that has had licensure for a long time. So we just want to make sure that we have the support of other healthcare payers. For example, Blue Cross Blue Shield of North Carolina is a huge supporter for us here, which helps. So that's where I would leave it right now.
Thank you, Manju. And it's such a good point that even if your licensure is not on the chopping block, I mean, you have to continue to advocate for this topic and continue to educate legislators. I know it's much easier to kind of talk to our members about this issue when it feels like such a threat, but it's really in those off seasons that you're building that relationship. And I love what you said as well about the talks around employment, because that is a big talking point in our state of Iowa as well, around licensure. And so, Tina, I'm wondering if you'll kind of talk about what some of our affecting talking points are in Iowa around this topic.
Yes, I totally agree. Thanks, Manju and Kat. Employment and jobs, for sure. That's definitely one of the priorities that we are talking about. Personally, one of the things that when I talk to my representatives is I ask them, do you know what a dietitian does? I mean, do you know anyone who is a dietitian? And it just so happens that my representative, he actually said to me, yeah, I do know what a dietitian is and what they do, because my family member had diabetes and they went to a registered dietitian, and things got so much better with their treatment and their care their care team because of the registered dietitian. So right then I was like, when? And every single time I contact him now, I talk about, remember that family member that went to the dietitian? So I bring that around a lot. So whenever I have communication with him. So yeah, that and of course the compact. I did tell him about the compact that we're hoping to introduce at some point. I didn't know when, and he was very responsive about that. So, and of course, employment and jobs, and I always talk about cost. How much does I'm a diabetes educator, so guess how much diabetes costs the state of Iowa. With missed work and just the whole cost of the treatment of that disease. So.
Thank you, Tina. Connie, do you want to finish us off on this one?
Yeah, reinforcing comments that have been made about the lobbyist piece. Missouri's been very lucky. We've had a lobbyist, the same lobbyist, for over 30 years. So the connections that they have really allowed us to get to the people we need to get to. And consistently, the message that seems to ring the bell the most, you've also heard many times, and that is, we're about protecting the public. And one of the things that we heard this year as we brought that forward, tying into the provisional licensure piece, was, well, what do they do in Iowa? What do they do in Kansas? What do they do in Illinois? What do they do in Arkansas? In other words, are we keeping up with the states that border us, or are we going to have Missourians who decide, hey, I'm going to go get licensed in Kansas instead of Missouri? Or the path to provisional licensure is easy in one of those. So it really was a significant sort of, they are paying attention to what's happening in other states as well, so that they're ensuring that, we're on par with where we need to be, but also thinking about, are we going to lose these young RDs who are coming out of Missouri academic programs because they can get licensed more easily in a bordering state. So, it's going to change how we approach what we're doing come January. So we'll talk about the public, we'll talk about protecting jobs and keeping them in Missouri, and that we're either on par with or better than our bordering states.
Thanks, Connie. Everybody had such great answers to this question. Thank you. Just expanding upon that, we were just talking about some talking points, but if you all have any other strategies that you're working on regarding licensure advocacy in your state, what strategies have been successful in the past when you've been working on this issue? And then if you want to briefly share if your state has any plans to work alongside the Academy on introducing interstate licensure compact in your state. And Connie, I believe we have you starting off on this one.
Yeah, we are going to do provisional licensure again. And again, we have already met with the rep who will introduce this for us. We are looking at, of course, she's in the House, so we're looking at the Senate side, and we'll work with her to identify that. The other thing that I did not mention early on is I am on the Missouri Licensure Board, and it's been helpful to go back and forth with that board and the Missouri Academy in terms of, we had a booth at the annual meeting. We did a session at the annual meeting of Missouri, so that we really can keep our members engaged and educated, especially since our annual meetings, as are so many states, are in the spring. So it's the perfect time in terms of advocating. So I think those are our big priorities. And the same rep who's going to do provisional is ready to do interstate for us, because again, she is a PT and she was involved, of course, in their interstate compact. Missouri has quite a few compacts already, which, given the state of Missouri, we've been very surprised about. So we're looking forward to it.
That is awesome. Thank you, Connie. Tina?
Yeah, in Iowa, our policy team has been hard at work interviewing and hiring a lobbyist for this session, and hopefully for future sessions, like some of the other states have had the lobbyist for many years. That would be great. We've had a lobbyist in the past, and they were successful in defeating our prior licensure elimination. So hopefully we can do the same thing this time. We are ready to work on Compact. So whatever the Academy has lined up for us, we are ready to go with that. And so we're really looking forward to that. Thanks.
Great, Kylie.
Awesome. Yeah. And thank you. I think for Idaho, I would say we're currently really focused, like I've mentioned, on responding to the recent proposed legislation that's sort of right in front of us and making sure that we're asking a lot of good questions and ensuring, where that leads us will ultimately be a good place. And it's where we want to land, thinking through now and the future of our practice in the state. So I think that's probably our sort of first priority, if you will. And just really ensuring our licensure remains intact and dietetics practice is not impacted in any negative way. So I think that's our first priority. We also have a public policy committee and numerous dietitian members who have a lot of history and knowledge on the subject of kind of what's happened historically for Idaho. And so we're ensuring they're included in our conversations related to this topic and others, and staying engaged with them as they're hearing things from the National Academy as well, and making sure that as we can, we're working together on those things. And then I think I would say we're just listening and learning as much as we can around compact licensure right now. I'd say currently Idaho's not intending to partake in any further advocacy around compact just yet. I can't say what's in the future for us, but we feel it's necessary to educate our members and be transparent with them and not cause any confusion. And so there's some other things I think happening right here and now that we need to be really responsive to first. And we have begun outreach efforts to our Idaho Academy members to build support across the state for legislative action. So that's been a big priority of ours, to make sure that we are building those relationships, as you all said, and making sure, our legislators and those across their state know who dietitians are, what we do, and the value we bring forward to our state. So reimbursement, I would say, is a big priority for dietitians in Idaho, and sort of responding to what's right in front of us, and reimbursement is probably Idaho's current priorities. So thanks.
I think
everyone. Yeah, go ahead, Manju.
Yeah, everyone has, stated just fabulous things you all are working on. Fortunately, North Carolina doesn't have anything specific related to our licensure to, pay attention to. But the act that I mentioned earlier, I just quickly looked it up. It's called Practitioners of Healing Arts, and that includes naturopaths, music therapists, and reflexologists. And there is an act right now in the legislature that is asking for their licensure. And, that's the one that I was saying that we're kind of keeping an eye on, is like, what are they going to include? What is it like? And what I will say is, we were very fortunate. Charla was our board's executive director when we were going through our modification of the Licensure Act back in 2018 and even years before that. But partnering with the policy initiatives and advocacy office of the Academy is absolutely crucial, because they have so much more experience. They've heard so many different ways in which things are being done, or, all the nitty gritties of little things. And it will really, make whichever state you happen to be in, whatever path it is going to be, when you're partnering with Charla and Lisa at the Academy's office, you're actually going to be way better equipped. So I will just put in a plug again for, the affinity groups that you heard about before, and also contacting them to ask more details that are very, very state specific.
Great. Thank you all so much. Again, we're just so thankful for your time today. Just a reminder that this webinar is being recorded, and we will be sharing the slides as well. So Lisa and Charla mentioned the office hours and the affinity group are some great resources to get tuned in and educated on this topic and ask your questions in the state. There's also a lot of resources on this topic on Eat Right Pro. So if you go to Advocacy and go down to Licensure and Regulation, you could see abundance of resources there on the topic. The Academy also has a grassroots advocacy guidebook, so I will link that. Sorry. So I will link that in our follow-up as well with this webinar. And then Charlotte and Lisa were saying that there's going to be an updated website eventually, but we'll also link the current website around Dietitian Licensure Compact. And I believe there's a recording in some of the previous webinars on the topic as well, if you want to get more educated on the compact situation. So for some housekeeping, before we jump into some more questions, feel free to start just adding some more questions in the chat if you have them, if anything didn't get addressed today. You will be receiving a follow-up email if you registered for this webinar. In that email, there will be a evaluation survey for today's webinar. Filling out the survey is how CDR credentialed dietitians and dietitians can receive 1 continuing education credit for having watched this webinar either live or recorded. So please fill that out and get your certificate. This information is really important for us to be able to improve future programming, maybe do some more webinars like this where we're collaborating and partnering alongside other states on different topics. Otherwise, I want to jump in to see if anybody has questions. I did see a question earlier from Heidi, and I don't know if Charlotte or Lisa, if you could clarify. Heidi asked, when will we be finding out what states are going to participate in the compact soon? I know you all said it's still kind of in the works of reaching out to different states. Do you all plan to share any sort of information on what states do decide to participate, or just further clarification on that?
Yes, so it should be the information that's going out this week, just a little bit of blurb in our public policy news and Eat Right Weekly, just notifying that we are close to finishing up on the language and that we will be working with states. And so then the plan is, to reach out to states individually and to talk with them about that strategy and where we're at. So in the next coming month and a half, where our aim is to truly have a meeting with each state and talk through where they're at in the strategy, why, address any questions and concerns. So your policy leaders in each state should be looking for follow-up correspondence from us regarding getting a meeting set up to talk about that strategy.
Great, thank you. Does anybody have any additional questions? You're welcome to also come off mute as well if you'd rather ask your question in person, or if there's anybody here from another state, if you want to educate us maybe on some things that are happening around licensure in your state, you're more than welcome to chime in as well. So I'll just give it a little bit of time to see if anybody else has further questions. Otherwise, this was a full hour webinar so far. I know I was a little bit worried about time, so we added on a little bit of a buffer at the end. So perfectly fine to end early as well if nobody has any further questions.
Pat, in the meantime, I just want to thank you. This was so informative.
Thank you.
Yeah, it was great.
Agreed.
Thank you.
Excellent job. Thank you.
Thank you so much. And thank you all so much for participating. It's a little intimidating starting a webinar sort of partnership that has never been done before. So I'm just so thankful that you all participated and helped this become a success. All right. Well, it looks like I don't have any other questions coming through the chat. Thank you all so much for attending today, and we'll be in contact about some follow-up information and resources. Take care, everyone.